Mhm. Um, I was reading about this USICH. Yeah. hmm They had a very small budget request of $730,000. Yeah. They're there to help those that are chronically homeless. Yes. And that's been my experience for the last 8 years. Yeah. For some reason, I just can't get the laws enforced. Yes. I can't sue my competitors. Yes. And I can't sue for the right to actually innovate, manufacture, and sell my innovations. Yeah. It's as if somebody bribed the police and sheriff's departments to intentionally refuse to acknowledge my rights. Now, you can appreciate that if I found out that any individual that has a uniform on, that has a badge on, yes, actually got paid to do this, it would look worse than retaliation. Oh, as if it were a private army, yeah, that doesn't recognize the obligation to protect the public. Mm. Now, it looks like this budget request that was a part of the 19 different, yes, 19 different, what are they called again? There's like a commission or something. I downloaded it because it caused me some concern. Yeah. I'm homeless because nobody wants to enforce my rights. Yes. And you don't want to give me my sons because I'm going to sue you. Yep. And this whole time, I documented all of this intellectual property. Yeah. And you didn't feel any compulsion at all to have to make sure that I had the right to innovate. Yes. What is important to me. Phew. Now, these deep pockets, that might be the Gates family, it might be Chase Bank or Jamie Dimon or any other special interests that want to make sure that Paul doesn't compete in the global marketplace. Yeah. I'm going to ask you on the stand, are you aware of any monies being received? Did somebody say they could buy a county of the United States? Did somebody say that they could buy a state known as Washington? Yeah. Is there some billionaire families that just don't want that global competition? Yes. Because I see it, there is a place for another operating system. Oh, the introduction of a new hardware. Yeah. In fact, there's a whole lot of room for lots and lots of competition. Now, I've been wanting to sue the Gates family for quite a long time. Yes. And it seems that you need to have one of these salt caskets, Melinda. Did you sew yourselves in? Did you do that? Um, I remember this CMS. Yeah, the Center for Consumer Information Insurance Oversight, Center for Medicare and Medicaid Services. Could you get me the employees of that? See, we passed a law called the Affordable Health Care Act. Yes. And all of us had to have insurance or we get one of these fines from the IRS. Yeah. And since I haven't been able to file my taxes because I haven't been able to get a job because you falsified my driver's license. Yeah. I thought I was going to sue Mike Van Proyn, and my thought was that I'd like to speak to Marilyn about her knowledge of organized crime. Could you arrange for Marilyn Van Proyn to speak to me today? Could you do that? I'm wanting to know if she wants to live with me. Now, this CMS, I'm familiar with them because I sold what's known as Medicare supplement insurance, yes, or Medicare Advantage plans where you didn't actually have to pay a premium. Seemed like somebody kept adjusting the amounts that Medicare would pay for certain types of procedures. It's like approximately 999 different codings necessary to how to get paid. Now, a lot of these in the family, Doctor, bring me some gold. They know what codes pay and what codes don't. And when I go through the coding of Olympic Medical Center and all of their billing for any Medicare or Medicaid, yes, it is such that when you go to a hospital and you're on Medicare and quite possibly Medicaid being the state services, yes, The coding decides the amount of money that Medicare will pay. Now, a lot of hospitals have a problem because even though they have to treat you according to the requirements of CMS, yeah, if the actual expense of the hospital visit exceeds the amount that they'll receive from Medicare, they feel a compulsion to get you out of the hospital because they're not treating you. Yeah. And my thought was that somebody was very involved in Medicare and Medicaid fraud. Yes, because of a little experimentation going on. Why don't you give me the CMS coding of all the Bring the Gold patients right now? Seemed like you were changing brains because of visiting the hospital. Yeah. Now, for the come to find out family that needs to come to find out, why don't you get me all the CMS coding of every individual on Medicare and Medicaid that's visited OMC for the last 25 years? Yeah. It would be that if you did know the codes that pay you the most, yes, even though it's not necessarily the thoughts of the doctor, it could be the diagnosis. Yeah. There is this concept that how do you know what they really think?